When coronavirus hit South Africa in early March last year, it seemed that one of the world's most unequal countries would be severely affected. South Africa launched one of the most vigorous public health responses on the continent. Pretoria took rigorous measures to flatten the curve with aggressive testing and screening and by preparing hospitals. These measures were accompanied by one of the strictest lockdowns in the world. Now, to speak to us about whether South Africa's COVID-19 strategy has been effective, we're joined by the African Health Research Institute Deputy Director, Professor Thumbi Ndungu. Good evening, Professor Ndungu. It's such a pleasure to be speaking with you tonight. I suppose, the big question is really what the lessons we have learned over the past year have been that will make us more equipped and better able to deal with the threats of a third and perhaps even a fourth wave of COVID-19.
Well, thank you very much, and thanks to the viewers. It's a pleasure to be on the show. I think that one can say that we have had, what I would call qualified success. We certainly have done better than a lot of other countries in the world. But in Africa, in particular, we have been one of the most heavily affected countries. I think that we could do much better. We could have done much better in terms of stemming the spread of the virus within the community. But having said that, I think there has been a lot of good political will shown to fight the pandemic. And I think the citizens themselves have cooperated for the most part in terms of trying to deal with the problem. But I do feel that when it comes now to the urgency of rolling out biomedical interventions, we probably haven't done as well as we could have done, particularly now with the rollout of the vaccine.
So what could we have done better?
I think that what the pandemic has exposed is the fact that we, in sub-Saharan Africa, in South Africa in particular, we were not well prepared, for example, for the research and development that is needed to develop vaccines. So we have relied on other countries basically to make effective vaccines, and then for us to get access to those vaccines so that we can test them in our population and deploy them to the population. So when it comes to the so-called non-biomedical interventions, non-pharmaceutical interventions, I think we have done well. The lockdowns, the hand washing, the social distancing, and people have been very compliant. But I think that in terms of vaccine, we have had to rely on others completely. And so we are at the mercy of other countries, and with the vaccine nationalism and other issues of that political nature, I think it shows that we have some weakness, and that we should, in order for us to do better and prepare for the next pandemic, we need to bolster our research and development, particularly for vaccines, as well as pharmaceuticals, to deal with this kind of pandemic in the future.
Research and development often needs the kind of resources that don't have immediate results. It's long-term projects that need to be invested in. Are we finding that this pandemic is changing attitudes towards where money should really be going at times?
I hope it does, and I hope that it's been a lesson for all of us that we need to invest in research and development. Like you say, this is research and development is a long term, and you can't just wake up one day with a pandemic and say that now you're going to develop a vaccine, because it takes infrastructure, it takes personnel that are well trained, and these things take a lot of time to develop. And so we need to invest over the long term in this infrastructure. We need to invest in human capacity to be able to deliver on these kinds of interventions. And to be fair, South Africa, I think, has done much better in that sense than most other African countries. And that's why you have seen, for example, vaccine trials have moved very rapidly in South Africa. But having said that, I think we still have some ways to go when it comes to the actual development of these kinds of vaccines and pharmaceuticals as well in order to combat this pandemic.
Of course, right now we're facing a situation where we're heading towards the Easter long weekend, lots of fears about a potential third wave. And, one of the difficulties is that there's often this sentiment of helplessness that is expressed, right? Almost like we have to surrender to the inevitable, that the third wave will most certainly come upon us. Are there practical steps that we can be taking to avoid a third surge of this virus?
I think it's the same things that we have been talking about since we don't have, a vaccine that has been rolled out widely in the community. One would have hoped that by now we would have much more widespread availability of the vaccines, and unfortunately we don't. And part of the reason for that is that the government, I think, wanted to use the AstraZeneca vaccine, and then it was shown not to be effective against the novel variant that was identified here in South Africa. And so that kind of slowed down things. So I think at the moment, we just have to rely on the social distancing and people avoiding crowds and, those kind of non-pharmaceutical public health approaches to combating the epidemic. Like I said, I think that now that we have vaccines available, I think we must move very rapidly to roll out these vaccines. Of course, that won't affect the Easter holidays because the Easter holidays are coming too soon. So for the Easter holidays, all we can do really is those non-pharmaceutical interventions, particularly social distancing and people avoiding large crowds. I don't think that a full-scale lockdown is the way to go, because we have seen that lockdowns have very significant impact on the economy. People need livelihoods, and probably not the right way to go at this stage, as long as people can still exercise a lot of caution, even without a full-scale lockdown.
That was Professor Thumbi Ndungu. Let me thank you so much for your time tonight. He is with the African Health Research Institute.